Good afternoon. I'm Donna McKay, the Executive Director of Physicians for Human Rights, PHR. Since launching in March, PHR's webinar series has provided a trusted source for healthcare workers, scientists, and researchers, advocates, and voices from the front lines to examine and speak to the implications of the pandemic through the lens of health and human rights. So I want to thank you for joining us today. This is our 32nd conversation in our COVID-19 expert discussion series. And our goal is always just to bring a science-based analysis and approaches to guide responses to this massive public health crisis. Today, we are going to discuss the COVID-19 crisis inside the walls of detention centers. We have the good fortune of benefiting from the expertise of medical, legal, and human rights professionals, including Dawn Wooten, an ICE detention center nurse who had the courage to speak out against harsh and inhumane conditions at the Georgia facility at which she was employed, and then was demoted after doing so. For more than 30 years, PHR has advocated for and defended the health and human rights of immigrants and asylum seekers. And through our Asylum Network, we've trained volunteer health professionals to provide critical evidence to substantiate asylum claims of survivors of torture, domestic abuse, trafficking, and other forms of persecution. We have over 400 people live with us today to listen to our esteemed panel discuss the hazardous conditions within ICE detention centers and how those conditions contribute to the heightened risk people in detention face during a pandemic, and the steps that need to be taken to ensure the safety of all individuals in ICE detention. And I think we'll also talk about opportunities under this new administration. So I'm grateful to have Dr. Ranit Mishori join us to moderate our discussion. Dr. Mishori is PHR's senior medical advisor and a dedicated advocate for migrant health. During the COVID-19 pandemic, Ranit has played a leading role in PHR's partnerships with advocacy organizations that are dedicated to protecting healthcare workers, detention litigation, and just overall refugee protection. Dr. Mishori has been a member of PHR's Asylum Network since 2006 and has served as the faculty advisor to Georgetown University's asylum program since its inception in 2014. She is a practicing family physician, a professor of family medicine at the Georgetown University School of Medicine, and the interim chief public health officer at Georgetown University. She also co-authored with Dr. Peeler and others PHR's recent detention and COVID report called Praying for Hand Soap and Masks, Health and Human Rights Violations in U.S. Immigration Detention During the COVID-19 Pandemic, which investigated the abuse and negligent medical care within U.S. immigration and customs enforcement facilities. So Ranit, I will turn it over to you to introduce our panelists and get our conversation started. Thank you.
Thank you so much, Donna, and thank you everybody for joining us this afternoon or morning or evening, depending on where you are. I'm speaking from Washington, D.C., and there's certainly a sense of little bit of lightness in the past few days and some good news coming from Washington. We're seeing the beginning of a much anticipated shift with the Biden administration undoing some of the previous administration's egregious immigration policies. Among some executive orders that President Biden signed yesterday was an executive order where the administration announced that it will pause deportations for 100 days. They announced that they would halt construction of the border wall and work on its priorities for arrests and detention. But clearly there's a lot more to be done. And in the meantime, and as the coronavirus pandemic continues to rage across the United States, thousands of people, if not tens of thousands of people, are still find themselves in immigration detention as we speak. So I'm so excited to welcome our amazing guests to discuss migrant health, dual loyalty, and whistleblowing, all in the context of COVID and immigration detention. And I would like to start with Dr. Catherine Peeler, Katie, who I'm honored to work alongside. Katie is a pediatric critical care physician at Boston's Children's Hospital, and she's a faculty member at Harvard Medical School, where she's also the director of the Asylum Clinic. She's a longtime PHR collaborator and co-author of our recent report that Donna mentioned about human rights violations in immigration detention during COVID. So Katie, I want to ask you to tell us a little bit about what we have learned from this report and even previous to that about conditions inside ICE facilities during this pandemic.
Sure. Thanks so much for having me. And again, it's really an honor to be on this panel, particularly with Don Wooten. We learned a lot. So, not surprisingly, conditions in any sort of detention setting are not great from a public health perspective, whether that be ICE detention or jails or prisons, anywhere where it's a congregate facility and people are in large groups. And so what we ended up doing, myself, Ranit, several other people from PHR, as well as a bunch of really amazing medical students from Harvard, is that we actually ended up interviewing 50 people who had been in ICE detention, 50 immigrants who'd been in ICE detention during the pandemic, and essentially asked them in a semi-structured manner about their experiences. And we compare those experiences and what they said was going on with the actual pandemic response requirements that ICE has published. It's their personal guidelines or how to respond to a pandemic in their detention centers. We use that. We also use the national detention standards, which are followed by ICE. And essentially, although not surprising, but still important document, people's experiences in detention were not they were not consistent with what ICE had said they were doing in terms of the pandemic response requirements. So first of all, most people didn't learn about COVID-19 and what was going on from ICE, despite ICE having an obligation to educate people. Most people found out on the news. Sometimes we also heard from people that when they were watching the news, that various people within the detention center tried to turn off the TV or downplay it as though it was not a big deal. So people felt very scared that they didn't have the information they needed. Almost no one was able to maintain a 6-foot distance in their sleeping arrangements, and definitely not when they were eating together. There was virtually no hand sanitizer. Hand sanitizer was almost laughed at when we asked about that. But in terms of soap and water, the access was not consistent whatsoever. Sometimes people used just water. Sometimes they used things like shampoo, or they would run out of soap within the first 3 days of the week, and they were only given a tiny allotment of soap each week. So there were there was just a lot of transgressions. And then from a testing and care perspective, testing really was our study, I should say, went from, we talked to people who were released from detention from March through August. So it was during those months of the pandemic, and testing was really negligible. Almost 50% of the people that we interviewed had symptoms of COVID. Whether or not they had COVID, I don't know, and they don't know, because the majority of them weren't tested. And actually 3 people we spoke to didn't even report their symptoms to ICE because they were so worried that if they reported their symptoms, they would be thrown in solitary confinement or otherwise suffer retaliation, including sometimes loss of commissary access, which is where you get that very soap that you need. So it just was a kind of vicious cycle of non-adherence to public health measures, fear. I see Dawn shaking her, or nodding her head rather, so I'm assuming you're going to corroborate a lot of this. And people were just scared. They were scared for themselves. They were scared for others. They were scared for their family members at home and having no idea what was going on in their home countries. And it just was a really terrible setting. So I'm happy to answer further questions kind of as we go along, but that was the experience that we had from the study, and certainly from my own experience, having been to various detention centers in the past, very congruent with what I know to be true as well.
Thanks, Katie. And we just posted the full report in the chat if you want to read it, or just look at even just looking at the graphics can give you a little bit of an idea of how awful it was in there. I want to turn to Dawn, and you are, as you could probably already gathered, you're a little bit of a rock star and a celebrity in our world. And Dawn Wooten, she's a licensed practical nurse, and was a nurse at the Irwin County Detention Center in Ocilla, Georgia. And she grabbed the headlines with her allegations about inadequate medical care of detainees during the pandemic. Dawn, your whistleblower complaint prompted a serious and important chain of events, agency investigation, calls for reform from immigration justice organizations, from medical professionals, from members of Congress, and even a class action suit on behalf of women detainees who were victims of non-consensual and invasive procedures while they were detained at that facility. Certainly made a huge splash and was all over the news. So thank you very much for your courage. Can you tell us a little bit, what was it that you've seen that troubled you, and more importantly, At what point did you decide that it was, you couldn't be silenced anymore and that it was your duty to say something to somebody?
Good afternoon. I'm honored to be on this panel with such a wonderful group of individuals. Thank you for the opportunity. Working at Irwin County Detention Center, I have been in and out of the facility 3 times. Started in 2009, I went back in 2014, and then I went back this last time in 2019. Coming back this last time, it was very different. It had always been questions, but nothing that you could just kind of put your hand on to say, hey, this is going on in the facility. I had a young lady, 23 years old, was the first kind of just hair raising experience. Say she had had a procedure done and she wouldn't be able to have kids, and could you check into it? Long story short, I brought her back. She had a hysterectomy that she said she didn't consent to. Her husband was going to leave her, was a sick call nurse at that time. Coming into 19 with COVID, I myself have underlying health conditions, as well as children that I go home to have underlying health conditions, and parents that were coming along now suffering, dad 4-stage throat cancer, mom breast cancer at the same time. And I began to ask my supervisor, we received a detainee from another facility, and the warden called down and spoke with one of the nurses and told her that we're getting this gentleman, there's a possibility he could be COVID positive. We're looking at this in the beginning of February, and we're receiving this individual at the facility, and she reported to the nurse practitioner, and the nurse practitioner had a meeting with all of us and said, hey, protect yourselves. This is what it is. And he instructed her not to tell anybody, to keep it to herself. But she informed the rest of us. I asked, was this detainee positive? What happened with this individual? The results were hidden. I actually found them compiled up under some other papers, and he was positive. We were told that they were not positive. I, in turn, then myself began to wear a face mask. I purchased a face mask, and it was a cloth mask. And I was told not to wear it. You don't need to wear it. We don't have COVID in this facility. Don't do that. You're going to spark a mass pandemic inside of the facility. So time progresses on, and we begin to get more detainees positive. So we have numbers now that are positive. There are forms that are not being filled out with the human health department. The CDC is not being made aware of what's going on. The numbers are reporting at this time every day, and our facility still says 0. And I know we have positive cases. So we're coming along the time now to where we have positive facility workers or officers at the same time, as well as positive detainees. And we're told not to report this. You know, we don't have COVID in this building. Do not go around telling people we have COVID in this building. I asked my supervisor several times, hey, are those forms supposed to be filled out? What is that? Is the health department supposed to be aware of this thing? That's not any of your business. And coming in, and you see these employees sick as well as detainees sick, and you're telling me not to wear a mask. So we progressed to the time to where we're coming down the end of February, in March, to where the facility gets over 900 N95 masks, but they're locked in the warden's office. So it's to the point to where now, you know, you've got to ask for protection for yourself. The nurse tells me, nursing supervisor, that there are masks that are in the warden's office. You have to see the warden to get them. We're working a weekend at this point, and no warden's present. He's home for the weekend. So there's nobody to allocate or allot us these masks. And I begin to ask questions and say, I mean, what is really going on? Why are we not reporting this? Hey, I have underlying conditions, and we're told to keep silent. And then with that being said, I have these women that are coming to me as well. Hey, Ms. Wooten, you know, I get so many this week, or so many this day to say, hey, we're having this procedures, can you check into it for us? I sat down in the office and I was sitting with a nurse, and my supervisor was adjacent to us in her office. We're not being 6 feet maintained. We don't have hand sanitizer. Nothing is being cleaned. Nothing is being sanitized. One of the exam rooms is so busted you couldn't clean it, and they're coming in one behind each other. And I'm seeing the detainees making masks out of socks, cutting up jumpsuits, making masks, going to the hole for making masks, or put in solitary confinement for making masks. We sit down at the computer and she's putting in orders, and she says, well, everybody that goes out to this position has this procedure, haven't been back 2 months. And I'm like, what are you talking about? The supervisor at the time rolls her chair out and says, everybody that go to him, he do the same thing to him. It's about money. Rolls her chair back in, and that was the end of the conversation. And I go to work one day and I'm demoted. And I'm knowing in the back of my mind why I'm demoted. Because I'm in a small town facility and I'm raising concerns about what we don't have, what we don't need. It's not supposed to get out into the community. We were being told at the time that COVID was a community disease. It was not a Irwin County Detention Center disease. Being in mind that we all live in these communities and we work from these communities, that it's not just a community disease, but it's Irwin County Detention Center. I enter the office, I go in on a write-up. So now there's a case being formed and I'm a no call, no show. I was out sick, had a doctor's excuse that said, do not report back to work until you're symptom free. But because I was told I was an essential worker, put on a mask, come to work. I was coming to work. The thermometer was being done by officers, 88.7. You telling me to write down 97.3, and I've been nursing at this point 11 years, so I know better. And you have symptoms on the sheet that says you can't come to work if you're symptom free. I asked about that. The sheet got changed and said that you can't come to work unless you've been in contact with someone with a positive case. And I said, well, that would be all of us because we're out in the community. We don't know who does what. Sheet got changed again that says that, you know, even though you have symptoms, you can wear a mask and still present to work. So after being rolled up by this time, between the ladies and the COVID and me being afraid to be sick, and my physician telling me if I contract COVID with sickle cell disease, that it will be hard for me to recover. I single parent 5 children. I want to see them raised at this point. I want grandkids at some point with these kids. And it just gets to be overwhelming. And after getting in your vehicle day after day, crying home, I have a 20-minute ride home, to where when I get home, I'm raccoon-eyed. And my kids like, Mom, are you okay? It's time to say something. I shared it with a local, well, with an attorney that helps my son with special needs. Ms. Kamala Buchanan was how we got started. And she connected me with Project South, that in turn, government accountability was reaching out at the same time. So we worked into that collaboration, and they made it so easy to tell this story. And it was supposed to be told because it was the right thing to do. I was raised to do what was right. And as soon as it was expressed, it was hard, but it was a weight lifted, because it was not just my life. Then I have to deal with my morals, and I have to sleep with myself at night because I have kids, and I will want the same thing, whether they were incarcerated, whether they were immigration, female, male, I would want them to be treated the same way. And a lot of the things that Miss Katie was talking about, no hand sanitizer, you have it, but it's locked in the supervisor's office. No mask, you have them, but they're locked in the supervisor's office. And you don't have Lysol. At this point, we were purchasing Lysol and bringing it to work ourselves for protection. We're in these little fitted rooms to where there's no way to social distance. The detainees are being brought to chow, no less than elbow length, if they were elbow length apart to eat. They were in the hallways, and a lot of them were coming sick. We still was allowing visitation at this place, even though the physician recommended that we close it down and we sanitize it, not to let anybody in, not to let anybody out. But we were still allocating visitation, and people were coming in off the streets, and people were visiting, and no one was being made aware that we actually have this inside of the facility.
Thank you, Dawn, so much. And what you're saying there, we're going to kind of try to cut it into pieces a little bit later. But for now, I'm struck by what you said, that you were raised to do the right thing. And I want to take this to Dana Gold. Dana is a senior counsel and director of education at Government Accountability Project. She serves as the lead counsel for several DHS whistleblowers who have disclosed systemic risk of harm to migrants in detention. And Dana, when Dawn says she was raised to do the hard thing, I don't know that many people recognize how hard it is to do the right thing, and that being a whistleblower is, and it can be potentially very risky. So can you tell us a little bit about your role in working with health professionals who decide to blow the whistle about ICE policies or detention or even other issues?
Yes, so many things going through my brain right now. It's always, even though I work with Dawn for so long and all of these whistleblowers, it's still, I get chills at the honor of getting to work with ethical employees who do the right thing. And it's just so incredibly gratifying. So thank you. And thank you for this panel being able to talk about such important issues. So Government Accountability Project is a national nonprofit organization, and we represent whistleblowers who have complicated legal needs and often suffer reprisal for blowing the whistle. Ideally, they come to us before they blow the whistle, and we can help them navigate that with a little bit less risk. And I'll talk a little bit about our work with Dr. Allen and Dr. McPherson, who that was actually a great case study of that. But then we also work to make sure their disclosures make a difference, because that's actually why employees are speaking up in the first place, right? It's that they see a problem and you usually can't stay silent about it. Often they don't define themselves as a whistleblower, though. They see themselves as ethical employees who are just doing their job, right? They're reporting wrongdoing in the workplace. And only when they suffer reprisal, their world kind of falls apart and it's incredibly disorienting. But we work to make sure to, again, ideally mitigate risk or certainly seek justice in the case of those whistleblowers who do suffer retaliation, but working with the media and Congress and oversight agencies and other public interest organizations to leverage the information provided by the whistleblowers to make sure that the speaking out, is, it does make a difference, again, which is why they're speaking. And so it's super complicated and super risky. The legal landscape is a patchwork of protections. No employee would understand what their rights are really until usually it's too late. But we started actually around when the separation policy was starting. And as you recall, whistleblowers actually were one of the first to catalyze awareness of the separation policy. And Tar Davidson at Southwest Key blew the whistle on the no hugging policy that they were implementing, and then the ProPublica reporting of the cries inside of the tape of the people crying for their parents, and that was obviously by an inside employee who gave that recording to a lawyer who then published it in ProPublica. And so the power of information provided by whistleblowers is really incredible at catalyzing change. And your comments, Ranit, about the reaction to Dawn's disclosures is a great example, right? Just overwhelming calls for reform. Investigations are happening, both civil and criminal. Women are not being referred out anymore at Irwin. It's really catalyzed, and now there's class action suits. And so it really has catalyzed that much more level of awareness that the whistleblowers who preceded Ms. Wooten, and of course, all the amazing reporting and activism that's happened, it really is this, it's catalyzed awareness of a need for dramatic change within, how ICE detention is managed. And I'm interested in this odd period of not knowing how to get my brain around it, working with an administration that actually isn't knowingly and intentionally harming immigrants. So that's a weird sea change as an activist, to be in that environment. But yeah, no, we started, I'll just quickly reference, when that separation policy was coming down, we were approached by, we basically put up the bat call to realize that there are probably workers in the ICE detention system who are very concerned about what they're seeing and want to speak up. And so, we kind of started an education campaign to educate them about their rights. Simultaneously, I believe it was PHR that referred Dr. Allen, Dr. Scott Allen, to us, and he has been the medical subject matter expert for the Office of Civil Rights and Civil Liberties with Department of Homeland Security for, probably 7 years now. I'm losing track of time, but it was 6 probably last year. And he, along with his colleague, Dr. Pamela McPherson, who is the mental health subject matter expert for the Office of Civil Rights and Civil Liberties, they came to us saying, we are very concerned that while they may not be separating children from their families, which is horrible, the alternative of detaining families with their children is still going to cause harm. It is going to cause imminent harm. We know that detention causes harm. And we also know, because we've been doing inspections of family residential facilities for years, that the care provided at these facilities is inadequate. And when you increase populations in detention, you're going to have imminent harm. And we want to speak. We can't stay silent. And so luckily they came to us before they decided to escalate that in a public way. And we were able to help them do that in a way that protected them as current contractors, by doing it in a way that very carefully and very intentionally did it within the context of their rights as federal contractors to blow the whistle. And so we did it by making disclosures to the Office of Inspector General, to CRCL, and to Congress, in a way that would insulate them from retaliation. And it actually ended up being quite effective that way. They retain their contract with CRCL. They've been valorized. PHR honored them. At their gala, they run the Ridenour Award for moral courage and truth telling. But working with them and very carefully helping them make disclosures in a way that was protective, and then escalating to the press when they were insulated and safe, really allowed us to, frame their disclosures as positive. And I think that that's been so important. And I know that Dawn, appreciating the love she's receiving, certainly professionally, I have to say this was so true for Scott and Pam, that having the validation from the professional community, 14 professional organizations came out a week after they blew the whistle saying they did the right thing. We call for an investigation into harms to children in immigrant detention as well. Whistleblowers are professional. These are medical professionals we're talking about largely. Not all of them are medical professionals in terms of whistleblowers, but in this context. But all of them are workers, and usually their identity is very much tied to their profession and to their work. And so to have the voice of the professional community and outside stakeholders standing up and saying they did the right thing and they're right, we're validating their concerns and they need support. It helps at the micro level in terms of the person, because the information, we care about the information deeply, but that information is tied to a person. It is tied to a person. And it is a hard thing to become in the public spotlight. It changes your life, sometimes for the better, right? Sometimes it's defining in a good way. Most people would say, I would do it again. I might do it differently, but I would do it again. I couldn't stay silent. But having that support culturally is important for the person in terms of the risk of reprisal and giving them moral support, as well as for ensuring their disclosures make a difference. So I can talk a little bit more after about the work we've done with other whistleblowers, including Dr. Scott Allen again, who when COVID started, we helped blow the whistle along with his colleague, Dr. Jody Rich, warning about what would happen with the spread of COVID in ICE detention in February, first internally, and then publicly in March, saying, we've tried to raise concerns internally to DHS, letting them know that these ICE detention facilities are tinderboxes for the spread of COVID. They will are a risk to workers, to detainees, and to the public. We help them raise those concerns, hoping that de-escalation of populations would happen, which did largely through litigation. Their letter to Congress was used to release hundreds of support to release hundreds of detainees from detention, and that's why we do see a de-escalation in those populations. But then subsequently, we had whistleblowers at the Richwood facility in Louisiana, also run by the same company that runs Irwin facility, LaSalle Corporation. We had guards at Richwood blowing the whistle on exactly the things that you documented in your report, Katie: not being allowed to wear masks, not separating sick from healthy detainees, using isolation, fabricating testing results, deporting folks across the border knowingly positive, just horrible disclosures. And then when Dawn came to us with Project South, we knew this was a medical professional who had seen firsthand exactly the problems that Scott and Joe, Dr. Allen and Dr. Rich had warned about in February and March. And so hopefully we'll see a sea change. The one thing that I was disappointed about, and we'll maybe talk about this in a second about next steps, is that you know, it's phenomenal just having a national COVID plan. Like, it's just like, I can't even speak about what this is like. But missing, right, are recommendations around detention facilities, you know, from ICE facilities as well as correctional facilities, because they are still vectors of spread. So we'll talk about that.
Definitely going to talk about that.
Yeah.
But I wanted to go back to something that you said, that information is tied to a person, and also link it to what Dawn was saying about how results were hidden, and the issue of transparency that goes beyond hearing voices or the stories of people from the inside. And maybe, Katie, I'll take it I'll pose this to you, because you and I, with a group of wonderful colleagues and medical students, also worked on a study about trying to gauge the number of cases in ICE detention centers, the number of positive cases, and hit a wall with getting correct and updated information. Do you want to talk a little bit about what it's like? What kind of transparency are we actually looking for?
Yeah, you know, you would think getting some like simple epidemiologic data out of anywhere in the United States would be fairly simple, right? Especially if we're just asking for number of positive cases and testing and things like that. But actually, ICE has made it very, very difficult. So on the one hand, what they have reported on their website, and we can put the link for their website up there, has changed. So they don't report the same data from week to week, and the way that they report it changes. So it makes it very hard to interpret, and you have to really read the fine details to make sure that you're not doing an incorrect analysis. You know, the data is incomplete. So for a long time, there was no information about employees. And then there briefly was some information about employee positive cases, but it was only, if you read the asterisk, it was only ICE employees. And as Dawn knows, a lot of people who work in detention centers are not technically employed by ICE. I would say a very large proportion are not employed by ICE. And so they didn't feel the need to report those people because they are subcontracted by CoreCivic or by Geo Group or by, you know, lots of other organizations that contract with detention centers. But just because you work for ICE or work for Geo Group does not mean that you are more or less infectious. And so that's still important to the math to know all that. And then even that small amount of information that was there was taken down. And so the employee positive cases are now not there, or at least they weren't when I looked probably 4 days ago. And so we actually had to just download all the data historically every single day from the dates that we wanted, and then analyze it that way, as opposed to just going to the website and getting what we needed. And the Marshall Project has also done something somewhat similar. They actually, I think, had an auto-generated, they were fancier than we were, but to get data. And so it just shouldn't be that hard. You know, and it's very hard to make decisions and public health recommendations if you don't actually know the information and the data, right? And so we basically kind of combined what we heard from people firsthand through our study, and then the information we were able to gather from ICE's website to understand what was going on. And essentially the bottom line is that the positivity rates in ICE detention, at least for the first 6 months of the pandemic, were drastically higher. The case rates were between 5 to 20 times higher on any given month than they were in the US general population, which again is not surprising, but is really disheartening when the case rates are so high and you are concurrently learning from people who are detained that there is nothing being done to stop that or to stem that, right? Like there's no hand hygiene, there's very little testing. There's certainly not appropriate isolation in a humane manner for someone who actually has symptoms. There's lack of access to medical care. There's kind of all the things that you would want in a setting where there's very high rates. All the things that you would need to make that better are not being employed. So the lack of transparency with the actual lack of implementation of their own published pandemic response requirements really has led to this blossoming within detention centers.
Thank you. I wanted to go back to Dawn, and you are a health professional, and I think you and many other health professionals are faced with what we call dual loyalty, sort of this potential conflict between our duties to our patients and our obligations to employers, and in this case, people who run immigration detention centers. And we see that often in the context of carceral settings in prisons and jails and of course, immigration detention. And so what I'd like to hear from you is when you came to the conclusion that you couldn't be silent anymore and you needed to speak. So you clearly went on the dual loyalty spectrum, you were on one side, but what happened with your colleagues? How did they feel about you, disclosing this kind of information? Obviously, none of them did in the same public manner that you did, or maybe not at all. So what was it like to go back there and look at your colleagues and say, what happened to your oaths to protect and to put patients' lives and well-being at the core of our professional responsibilities?
It was once they saw me demoted, that was the last they saw me, then this story hit. So I didn't have to go back and physically face anybody, but I received phone calls from those that worked there, and they were like, thank you. I had one nurse that called me and said, thank you, Wooten. I'm sorry that I don't have the faith that you have, but if you need anything, just let me know. I had another colleague to call me and say, Wooten, that mouth. I said, yes, this mouth has always been a thing for me. But she said, in all seriousness, I mean, I have this going on at home and I have this person that I'm taking care of at home. I just can't lose what I have right now. And in the beginning, I'm gonna be honest, brutally, I was angry because we all sat around and we discussed these things and we knew this was taking place. And it was kind of like this need to be said, or that need to be said, or this need to be done, So it started out as hey, I'm behind you 100. When it finally hit, all the pressure was dropped in my lap. So you hear in the community mixed emotions and mixed feelings. You hear from those that work there, hey, we support you, we got you, good deal. I got a flood of people that were presently or previously employed there that were congratulating. And then you're gonna always have a group that's thinking that you're after their job, but not understanding the concept to where it's your job to be loyal to your job as long as it's loyal to you and it's doing what it's designed to do. When it crossed the borders of saying, hey, we're going to treat people this way, or we're going to treat people inhumane, and we're going to keep this inside, so we're going to make this a silent pandemic inside of a pandemic, my Lord, it shifted quickly outside of what anybody else thought, because I take the temperament when I know that I go to do what's right. I'm unapologetically me. And we have the lives of others that are stemming and depending on us when we come to work. They're depending on whatever their charge, crime, whatever. You put that, or I put myself in their shoes. and I just began not to worry about the negativity from some colleagues and the positivity. I took the positivity running.
It's certainly a tough situation to be in, and I think there are a lot of messaging here saying what a role model you are, and what an amazing person you are, and so do you see yourself as a hero here?
No, ma'am. In short, my brother called me when this thing first broke. And he was like, "You're a hero." I said, "I am not. Stop saying that." And he said, "I mean, these people, you are saying I am not. Stop saying that." So it still, after all this time, has not sunk in, because I was raised with humility and humanity. And I was raised to, whether you were recognized or whether you were not recognized, you always do what's right. Because I take that precept from my granny years ago. She raised me, church mother. So I grew up in the church, and you treat people. It was like beating a dead horse. You treat people how you want to be treated. So I took the concept of treating people how I wanted to be treated. I don't view myself as anybody special, just doing what was right because it was right. It was the right thing to do.
Dana, I think there's a sort of a misconception in the world out there that whistleblowers are perhaps disgruntled employees, that they want to, they want somebody to that's just a form of a payback for something. And is that your experience, that people like Dawn and Dr. Rich and Dr. McPherson, Dr. Allen, that they're disgruntled employees?
Oh, completely. No, I'm just kidding. They are, no, that is totally not our experience, but that is one of the biggest myths that I have to bust. They are typically the most loyal employees. Sometimes I see them, I describe them, not always, there are always exceptions, right? But the majority that we see, sometimes I say that they miss the memo, that speaking up would result in reprisal. They believe by speaking up. I think this is actually an important factoid that people don't understand about whistleblowers, is that the majority, 95%, overwhelmingly report internally first. They don't go to the press first. They don't go outside first. They report internally first. And that's because they actually believe that something will be done about the problem. Which is such a sign of a statement of faith in the institution, the organization, that it will do the right thing. Usually they report twice before they go outside. And so they're two pieces that they're really important pieces of that. That one, if a whistleblower is coming to you as a journalist or a public interest organization, the likelihood is they have reported internally first, which means that their risk is potentially higher for retaliation. So being careful if a whistleblower comes to you, to your organization, at some level, knowing that know that their fingerprints are on that information. It's why I always say that information is tied to a person. But I think that the key about them reporting internally first is, again, it says so much about that whistleblowers are usually not motivated because they're disgruntled. They're motivated because nothing's been done. And they can't stay silent, and they are not satisfied with the organizational response to the problem. They don't define themselves as whistleblowers. They define themselves as just, it's kind of like Dawn, even though she is a hero, I'll be the first person to say it. It's sad that we need her, right? And she's a hero because she made a difference, and because most people did not speak up to stop it. Right. And so I will say that for her, that she is a hero. But again, most people, they're not doing it for glory. They're not doing it for retribution. They're not doing it for money. They should buy a lottery ticket if that's their interest. It is not a path, to riches or a good life. It is fraught with risk. And it's basically, it's a hard experience most typically. But these are the people that you want employed. And one of the things that's been really encouraging to me already with this administration is that, Dr. Bright, one of the big whistleblowers who blew the whistle on the administration's failure to respond appropriately and quickly to the COVID pandemic, and was instead promoting bogus medical treatments for COVID. He spoke out, suffered retaliation, but the Biden administration has put him on the COVID task force. We represent all these Voice of America whistleblowers who blew the whistle on politicization of the Voice of America. That whole head of that agency has been sacked, and the whistleblowers are now running the office, right? And so these are the people that you want in positions of leadership and who you want working. And what's interesting to me, right, about Dawn is that we see her as a hero, but she's having a hard time finding employment. So she's still technically employed at Irwin. She's essentially constructively discharged because they're not giving her any hours in the way they've demoted her. But she's having a hard time finding alternative employment, but she's who you want employed. She's who you want, right, being your nurse in your organization. And so I do think that there's a sea change coming, but again, it really, it's a personal individual experience. The support helps, but she still is a single mom with 5 kids who needs income and wants to be able to work. And it's been hard because people are scared because she's a whistleblower. People don't want to be whistleblowers, right?
This reminds me of an article I wrote about a year ago when ICE published an ad looking for people to work as physicians in their facilities, and wanted people who, so to speak, followed orders. They wanted the people who are not going to be like Dawn, right? Who are not going to speak out and not adhere to their professional, moral, and ethical duties. We don't have much time left. I mean, it's amazing how time flies when we have such incredibly passionate and amazing guest here. But Dawn, before a few minutes ago, I heard a sort of a hint of disappointment in some of the executive orders that have been released at this point, and that there's more work to be done. And I want to just go to each of you in the 7 or 8 minutes that we have left, and wanted to think about or to hear from you what needs to happen. What else do we want from the Biden administration? And what is going to make us happier? How are we going to create situations where we don't need other Dawns out there? So maybe we'll start with you, Dana, and then go to Katie, and then lastly to Dawn.
Yeah, so I think it's for me, it's a 2-part. Actually, it's a very complicated question, but I'll try to keep it very short. From a global perspective, I think that ICE detention needs to be completely reformed. People need to be released. It's the problem with having private contractors running for profit for an agency that, at least for the past 4 years, has been, motivated by xenophobic, racist motivations to use detention as a way to deter migration very overtly. The evidence is overwhelming that detention causes harm, that the contractors and ICE are unable to provide adequate medical care. That radically needs to be shifted and changed. And I think that oversight mechanisms need to be radically strengthened because they are just profoundly weak. So that's, in the granular details of that, to be worked out and too long for here. But I think the second piece is, we're working very hard, certainly as we talk about the need for accountability for what has happened and to prevent it from happening again, so a reckoning as well as a repair. We do need stronger whistleblower protections. Whistleblowers need to be protected. We need to know that when they speak out, their disclosures will be listened to, but they also will have a remedy for reprisal and ideally a deterrent to experience reprisal in the first place. So we're working really hard on pushing in the next COVID relief bill to have stronger whistleblower protections embedded into that, as well as stronger protections for federal employees who desperately need a functioning legal system because it's completely broken. And so that is going to be in the Protecting Our Democracy Act that's embedded into POTA, because we need whistleblowers to speak out about wrongdoing as a way to, for democracy itself to work, let alone any issue we care about. So I would encourage, we actually have a sign-on letter for organizations to sign on to, where we're seeking support across organizations writ large, no matter what issue they care about. They should care about stronger whistleblower protections. And so encouraging, Congress to pass any piece of legislation, from OSHA to COVID relief to the Whistleblower Protection Improvement Act, is something very tangible that can be done. And I think is we're hopeful can happen in this term.
Thank you. Katie, from your perspective as a physician leader and somebody who has worked and visited detention facilities and has engaged in a lot of recent research about conditions, what needs to happen, and what about what can the administration do that in the coming weeks?
So, I am really happy that I feel like the administration has essentially kind of put a pause on a lot of the harmful policies, at least for a bit, while they reassess kind of what they want to do going forward. But I think overall, I think everyone in the country, regardless of which way you think this should go, agrees there should be an overhaul in the immigration system, right? Not everyone agrees about what the overhaul should be or which direction it should go. But I would say overall, there just shouldn't be detention. Right? I mean, very, very few people are actually a public danger. And that's really the supposed reason for detaining someone, is to detain them for a short period of time, understand who they are, and make sure they're not either a public health risk or mainly, really honestly, a danger to society. That shouldn't take very long to figure that out. And people are detained for very long periods of time. In our study, the average length of detention was 241 days. It does not take 241 days to figure out if someone is dangerous or not. And that was the average. So that on the long spectrum, people were detained for even longer. And so crossing the border without papers, so being, quote unquote, undocumented, really is a civil violation. And so you should, if the government feels so strongly, you could detain people for a short period of time and then release them. But ideally, you just wouldn't detain anyone. You would take their information, you would set up alternative to detention programs. ICE even implemented and piloted an alternative detention program, and it went great. People showed up to their court hearings, like there was no violations of what they were supposed to be doing. So their own study, which we can put a link to that for you in the chat, show that it worked. And additionally, it was so much cheaper. I want to say it was around the average of $30 to $40 a day per person for someone to be in that alternative detention program, as opposed to several $100s a day to detain someone. So there's a moral imperative not to detain people. There's an ethical imperative not to detain people. Logistically, it costs a lot of money. It makes no sense. It's dangerous to children, as Scott Allen and Pam McPherson showed. It's very dangerous to everyone. And it just doesn't add any value. And then additionally, there's been other studies showing that the majority of people who come across our border have someone to stay with. Like 95 to 98% of people who are currently waiting in Mexico to come across our border have family or friends to stay with. And so they could easily have a place to stay. So just from the pandemic perspective, they could quarantine and do everything they're supposed to be doing. So I would say my priority would be decarceration overall. And then my second priority is exactly what Dana said in terms of external accountability, really understanding what's going on and holding people accountable such that people want to do the right thing, so that when people like Dawn want to become whistleblowers or speak out, they're not reprimanded as such.
Thank you. And we'll finish with you, Dawn. Again, took a lot of guts to do what you did. What do you tell other health professionals who are thinking about it, who are seeing things, whether in ICE detention or in other institutions, that are seeing things that just don't feel right? What's the message here?
What I would tell others, that other healthcare professionals that see things that don't think that they are morally and ethically correct and they're right. If you have to second guess it, and if you have to question yourself, it's not right. If you find yourself in a situation having to justify a situation, it's not right. Something on the inside of you should give you an inclination to say, hey, something is wrong. And dealing with it where I dealt with it from a local level, it's a area that is, it deals very highly, it's a very prejudiced area, and it's a very small area. And it's the only place in this area that pays people above minimum wage without education. So if you don't have a college degree, then you can come in and make a decent living and live at a decent standard, as opposed to working at McDonald's or Wendy's or Chick-fil-A. So you're given a above wage for that. So you're sucked in financially. And once you get into a place that you've lived a certain standard and you've been in a certain arena, then now you're hooked to where you're going to do whatever. I've seen it for this certain arena. It's not all the time. It takes money to run the country, yes, but it also takes morals and ethics and humanity. We're dealing with humans. We're not dealing with animals, you know. And inside of this facility, I found myself looking at humans being treated as the underdogs as opposed to animals. Some of them inside of that facility treated their animals better than they did humans. No tag to any person that I love animals. I have a dog. I heard you about my dog, but I mean, out of all jokes, I mean, aside, I role reversal. That's how I find out if I'm going to ethically do what I need to do. It's a role reversal. I put myself in that place. I was able to clock in, clock out, 12 hours in, 12 hours out. And you have people that are there, like Miss Catherine said, or Katie said, you've got people there that are there 241 days. There were people that were there at this facility 4 and 5 years for minor traffic violations. You're driving on a suspended license, or you shoplifted. One girl was there 3 years because she shoplifted, feeding her kids in the Atlanta area. I mean, it's not that it's like you've committed murder, and then you find those that have those cases, they're shifted quicker than others. But it shouldn't be a question or hair-raising question when it's to do what's right. Yes, there's backlash. I'm my mama's weird little child, so backlash is, hey, water off a duck's back, because I can sleep at night. So to be able to sleep at night alongside your children, to be able to sleep at night in a comfortable setting, to be able to sleep at night and not having to worry about whether you're going to get up the next morning and your water's off because you didn't comply, or whether you're going to get the next meal because you didn't comply. Whenever things see you and they not just systemically bother you, but they spiritually bother you, then that's that innate ability to say, hey, I've got to do this. Dana said something earlier and I laughed because I mentioned it to her and I talked about it a while ago. If I had to do this all over again, yes, it would be done a little different, but it still wouldn't change the fact that I would not raise the whistle, because it could be easily my child, my grandma, it could be my uncle, it could be my sister, it could be my brother, it could be my friend, or, you know, not just necessarily an enemy that I don't even desire to go through the things that was seen and allowed inside of this place, because, you know, we can wear a pair of pants, buckle up a belt, and hold a position, but not be really positioned for that position. So whenever you get ready to, I encourage, I motivate, I encourage, raise a hair, stand together. I was at a place to where I thought 3 other people were going to stand with me and they didn't. So I'm out here by myself, but I thank God I'm out here by myself because I can sleep at night.
And we are so thankful for you taking that step, and your ability to sleep at night meant that so many people's lives are absolutely better these days. So thank you from all of us. We're almost out of time. And of course, there's still a lot to be done, whether it's releasing people from immigration and halting transfers or cutting funding to immigration detention, and not to mention ending family detention and working towards family unification. thinking about the role of private prison corporations and in general, as Katie mentioned early on, in creating a more humane asylum system in general, among many, many other things that need to be fixed. But I know the PHR and many of our partners will continue to be at the front lines of demanding justice for immigrants and ensuring that health professionals like Dawn have a voice in the process and without retaliation. So I am turning the screen back to you, Donna, to close us off. Thank you so much.
Well, thank you so much, Ranit, and to all of our panelists. You know, it's hard to comprehend the courage that it takes to expose wrongdoing and really life-threatening actions at any point in our environment. But the last 4 years in particular have been an environment of such intense intimidation and consequences at the very highest levels of our government that, of course, trickle down and have empowered government employees such as ICE agents like never before. Dawn, thank you so much for raising your voice and what you did. And Dana, for emphasizing the real importance of accountability and reform. We can't just move forward, although we're looking forward to a more humane set of policies and practices, but accountability has to happen. So thank you for reminding us of that. And Katie, for really reminding us of the importance of having humanity restored to our processes and systems, that no one who's seeking asylum should have to be in detention at all. So we do need that overhaul of the system, and we'll work really hard on that. And there will be times where we will hear even the best of intentions in the administration say that there's many priorities and a lot on our plate and that you have to get in the queue. And I would just say, as human rights advocates, we won't accept that answer, that we want to be at the top of the queue, because this is, especially right now, life and death for some of the most vulnerable people in our care. So thank you so much for this incredible discussion today. And just to let our audience know that next week at the same time, on Friday, January 29th, we will be having a very timely conversation on the ethics and human rights considerations of the COVID-19 vaccine distribution. And it will be moderated and led by Dr. Chris Byrer, who is at the Johns Hopkins School of Public Health and a member of PHR's Advisory Council. He's extraordinary, and he's assembled a really, really great group of panelists. You can register at the link in the chat box. You can register on PHR's website. And I just want to encourage you to share this link of this video with others on your social media platform, and particularly people who are in positions where they can create the kinds of reforms we're talking about and are needed. And of course, visit PHR's website, where you can find links to dozens of other COVID webinars. Thank you for your time today and for your caring about these issues. And stay safe, everyone.
Thank you.
Thanks, everybody.
Thanks, everyone.